Hello, everyone. I am Camellia, a psychiatric mental health nurse practitioner, also known as a PMHNP, and I'm also a nursing and mental health enthusiast. And I'm coming on today. I know that I have not been on in a while. About a month or so was the last video. And I want to first say thank you for all of you that have joined the channel. You've subscribed, you've commented, you've messaged me, you've sent me emails. I really appreciate the engagement, the communication, and I look forward to really continuing to engage with you guys here. As a result of some of that communication, I actually wanted to sort of delve into a question that I've gotten a lot recently, and that is specific to the projection of or the outlook of the PMHNP role. As far as it relates to job opportunities and sort of what that looks like in the future. And the question that I get often is this role saturated? Is the PMHNP role becoming saturated? Is it currently saturated? So I just wanted to spend some time today with some statistics as well as some of the things that I've seen and really been able to observe as a PMHNP and speak to that particular question about oversaturation, projection, the outlook of the role. So the first thing I want to say is that there has always been a shortage in psychiatrists or psychiatric providers that has existed for a long time. So if we're looking at the foundation of the mental health field, the psychiatry field, there has always been a shortage. And that is where the origination of the PMHNP role has become so valuable because we are helping to meet a demand that was already there. So an already established shortage, in addition to when we're looking at the outlook of any job, we have to look at the demands that we're trying to meet for that particular job. And I will say that we actually are probably looking at an increased demand from a perspective of more individuals seeking support. So the National Institute of Mental Health, or the NIMH, actually says that about 1 in 5 people suffer from mental health concerns. 44% of them actually seek care. So if we're looking at that, particularly as with that statistic, and we're now seeing that we have an increased awareness where we have people that are, actually humanizing the topic of mental health, understanding and recognizing what signs and symptoms are, and then also knowing that there are resources available. And we've seen this sort of across the globe with increased use of platforms to help increase awareness for mental health. So as a result of that, we have more people seeking support. And I can directly say that there is a correlation there because we're seeing more people who are seeking support for treatment, whether that looks like therapy, medication management, or just the general field of psychiatry. I will also say that sort of on top of that, we're also seeing that since 2020, and we all know what that looked like, we are seeing an increased need for mental health support. So not only are more people seeking support because of awareness who may have already had concerns, but we also have more people that have concerns that it's also driving up the demand. So I don't think we're meeting that demand. We're not catching up per se to that as of yet, because also we started with an already established shortage of providers. NAMI, which is the National Alliance of Mental Illness, also says that there has been on average a delay of about 11 years from the time of onset of symptoms to someone seeking treatment. So I think the other thing about this awareness piece is that we are actually closing the gap from the time that someone has recognizable symptoms to the time that they seek support. So what does that mean? We're having more patients and we're having more people that are seeking support. It's not a positive thing that we have more people who are suffering or struggling with mental health concerns, but it is a positive that we have the role of the PMHNP which can help to meet that demand. So I do think the patient, from a patient perspective, the demand is increasing, and we're not there yet in terms of meeting those demands. We also have other avenues of preventative care. So we have lots of employers now that are actually looking ahead to help support mental health of employees, and it's become a more recognizable thing, which is also driving more people to seek support. And also, if you do any research on the trajectory of nurse practitioners and the outlook of that, you're also going to see that because of the aging population, we are also seeing an increased demand. Also, being able to serve in underserved areas and also rural areas is where a lot of the psychiatry and mental health access has been focused, which also increases the need for providers. And again, PMHNPs have been able to fill some of those needs. I also see that because of the increased access, so access has been increased by telemedicine. And with that, because we have more people who are now more willing and possibly able to seek support if they live in a rural area or just from a convenience perspective are able to see a provider, we also now see that because of that access, we have more people seeking support, but we in turn have the need for more providers. So I think from multiple angles here, we're seeing that this demand from an already established shortage is just not there. We're not quite meeting that. But we also have an opportunity here as a PMHNP. If we're also looking at statistics from the Bureau of Labor Statistics, the nurse practitioner outlook actually looks pretty healthy. And it's projected that they're generally from all nurse practitioners, whether specialized or not, an increased trajectory of about 50% from 2019 to 2029. Deeming it as the second fastest growing job. If we sort of get that on a micro level, it's also predicted that there will be an increase in about 17% of specialized care for psychiatry and substance abuse treatment, and an increase of 26% in private practice for mental health treatment. So again, I think generally we have a little upwards of 12,000 or so PMHNPs practicing currently. So of course we have much opportunity to meet the demands of a growing population, more people seeking support, an aging population, increased access. We have an opportunity here that we can really help to support people. So I think if you're at a point that you are considering the PMHNP route, I would say first look at from an individual perspective or professional perspective. Is that something you want to do? What's your why? And then consider whether the outlook in your particular location, what that looks like. Of course, there are areas that may be oversaturated because maybe you're in a rural area that has already started to meet the demands or has been meeting the demands of serving patients for a while. And there just aren't that many opportunities. But again, you can also, as a PMHNP, you can stretch out a bit because of the telemedicine opportunities so that you don't have to be as specific as your geographical location to practice. So I do think that there is a way around, just being able to meet these demands. And I don't think we're going to see this being oversaturated anytime soon from a global perspective. Of course, there are pockets of saturation, but I think if that is a reason that you're considering not moving forward, if personally you've touched in and you realize this is something you really want to do, you feel that you'll have the fulfillment and able to really serve patients, then I would say go for it. I don't think we're there yet. It's probably going to be a while before we get there if we do. And again, I think as long as we're meeting that demand, just seeing this as a positive, not that we have more people needing support, but that we have an opportunity that we can provide a level of support for more people and patients. So definitely, I look forward to hearing from you guys. You guys let me know what you've seen, any other additional questions or concerns that you have. And again, as always, I look forward to engaging with you guys. I will also drop a couple of websites here below One of them actually is an outlook of the nurse practitioners by state. So it kind of gives you a trajectory of that. And the other one actually speaks to a lot of the statistics that I've shared today. So I'll drop those links here below the video. You guys can feel free to send questions, comments, anything else. But again, I look forward to talking with you guys as we continue, and we'll definitely go from there. Thanks.